Hi, my name is Alisa Minkin. I'm a general pediatrician. I'm also the co-chair of the JOMA Preventative Health Committee, and I'm excited to be here today with Dr. Sara Asher. Dr. Asher is a licensed psychologist specializing in the treatment of children, adolescents, and young adults. She's currently the director of school psychology at the Yeshiva of Central Queens, where she coordinates psychology services for kindergarten to eighth grade students. Previously, she was a senior psychologist at the Yeshiva University Counseling Center. In response to the pandemic, she has spoken extensively to parents, school personnel, and community leaders about the effects of stress on child development and strategies to build resilience. Last week, I interviewed Rabbi Yitzi Ross, who's South Shore fourth grade Rebbe and author of the popular parenting blog and column Yid Parenting. And he said multiple times that children in his class are doing well overall, and that children are naturally resilient, and that they're adjusting well to the new normal, including mask wearing. Parents can really help by setting the tone here. But as a pediatrician, I see many children every week, even before COVID-19, who have significant mental health challenges. Anxiety, depression, and attention deficit disorder, ADHD, are the most frequent issues I encounter. It may surprise some to hear that 1 out of every 6 children, according to the CDC, ages 2 to 8, have significant developmental and/or behavioral challenges. The rate of anxiety in U.S. teens aged 13 to 18, according to the National Institute of Health, is 1 in 3. Really high, and I'm telling you, I see it every day, so I know that to be an accurate statistic. So thank you so much for joining me today, Dr. Asher.
Thank you so much for having me. It's really a pleasure to be here and to talk with you, and I'm sure we're all going to learn a lot. Thank you.
Yes, and so I want to start with, how do you see the pandemic affecting the children? I mean, I know school started, not 2 weeks ago.
Right, right. Well, the truth is that over the course of the pandemic, I've really kept my finger on the pulse of how the children are doing and how they're faring. And when this all started, that was really on the top of our minds, how the children will do and how all the stress will affect them. And, we don't have much precedent for such an experience in children's lives. So, and to some extent, we're in the throes of this. We're not finished with it. So we can't make any foregone conclusions about how the children fared. But we can certainly keep our eyes open, and we've noticed changes in children until now, starting from the beginning of the pandemic. The best way I could put it is that there are two ways in which this affected the children. The most vulnerable children were the ones that experience stresses on a lot of levels. So there's some level of dose effect, right? So you have children that might have experienced loss during this time, or illness or fear of illness because of pre-existing conditions in their family, or loss of income. There have been for families that were already struggling with marital discord, those families, it got worse often. So these children were particularly vulnerable. And you see that in any, studies about abuse or trauma, that typically there's some kind of effect where the more stress makes it more difficult for the child to cope with that stress, and it eventually becomes toxic stress, where it affects all levels of the child's functioning. So that was a vulnerable population. And the second vulnerable population were children that already had pre-existing tendencies towards anxiety, towards emotional dysregulation, towards depression, or just having trouble in general coping or managing with stress. So I would say those were the two. And over the course of this time, most of the people that were calling me or had particular concerns about their children were referring to either of these groups.
So that's a good explanation. Let's start with the first category and talk a little bit more about them. What are you seeing in those children?
I think actually some of those children are, I think now that we've started school, I think to some extent for a lot of children it's regulating. They're back in a schedule. They're back in knowing they have a sense of control again. So for some of them, there's a relief to be back in school. But for some of the children, they're not quite ready, or they're still acclimating to the expectations of regular daily life, because I think they've been out of habit.
Right.
For example, it's like they haven't used the muscle of,
Right.
now I gotta focus on something,
Right.
and now I have to pay attention, and now I have
Right.
to work hard. So for families that were very stressed, I think the children had to take care of themselves to some extent, because it's there's stresses with money, stresses with marriage, stresses with health. So naturally, the children, to some extent, have to be more independent. So now they're back in school and they have to follow the rules, and they have to follow, classroom expectations, and that could be a little harder. So they might be looking more dysregulated in class.
So when you say dysregulate, I'm just trying to explain that. What you
Oh
mean by
yeah,
that, please?
so they might become, it will be harder to call their attention to back to class, or in the yard, they might be becoming a little bit more aggressive, or they're crying more easily, or they're getting more worried, or they're having difficulty separating from a parent to come into school. So those would be some of the examples.
So how can a parent talk? Because I know parents are going to be listening to this and saying, what can I do?
I think, I wouldn't, over the course of this podcast, I don't want to repeat myself too many times to bore anyone, but in general, I think that the most difficult part of this pandemic for the children, outside of the obvious health threats, right, to their family, was the complete loss of routine, the loss of habits, rituals, right? We all have them to some extent, but for this vulnerable population, I think they lost them to a larger extent. So bringing that back into the child's life is very important. That sense of, I know what comes next. The other thing would be to really tuning into your child. How are you doing? How was your day today? Who did you play with? Just like open-ended questions about how the child's doing, how they're feeling. Quality time with your child can be a board game also. It could be a card game, taking a walk around the block. Tuning in again. And I think for parents also that were very stressed, it's sometimes relieving to have the child outside the house for some of the day. So when the child comes back home, you have a little bit more emotional space for the child. So make that a point. And if you're if you're an essential worker, or you're at work a lot and you don't have, it's not spontaneous that you could find this time with your child, schedule it. Find a time to do it that works for you and that would work for the child also. Put it in your calendar, spend some time with my kid. And also, if the behavioral issues are persistent, they're ongoing, they're extreme, this is not like your child, at that point, you would want to loop some other people into the story to get some help with it. Talk to a pediatrician. And I also encourage parents to talk to the teacher and ask the question, how is my child's behavior as compared to the other children in the class? Because right now, I think everyone's a little bit off. No one's really, it's true what Robert Ross was saying, was that most children are doing okay, and I think that's true. But I think everyone doesn't look exactly the way they looked in February of last year. We're still adjusting to being back in school. We're still adjusting to the high levels of stress that everyone experienced. So you want to ask the question in that way, how does my child look as compared to how everyone else is adjusting? How is my child adjusting?
And how would you know when to seek extra help? What's the difference between a child who's fidgety because they're back at school? And by the way, Rabbi Russ gave a great explanation. He said the biggest problem is everybody's blaming the masks and the plexiglass. And really, it's what he calls the real issue is the children just not used to sitting still. They backtrack over the summer. They backtracked even more over the 6 months they weren't in school. So it's so simple. You mentioned it too, is just getting used to the schedule, getting used to sitting in place for a long period of time. But when does it go from being normal to being a problem?
So again, I think you would want to look at if it's an ongoing issue, if it's really unlike your child. So ongoing, I would say give it a few weeks. We have, I believe, 16 days from the start of school if you started the day after Labor Day until Sukkot.
Mm-hmm.
So I think you would want to give it until then to see how they're managing, and also that given that time frame, I would say, is it extreme? Is the behavioral change extreme? Is it very unlike my child? You need to use your own judgment as how far away is this from the way my child usually behaves.
Mm-hmm.
They're usually managing okay in school. There is a range by which they're it's changed because they're still getting used to it, or they had more screen time over the summer and over since school started. But there is a range of normal. But outside of that, you need to kind of have a sense like my child really doesn't have my child is having a very hard time helping himself or herself right now, and I need to be able to help them a little more. So again, it's kind of it's ongoing, it's persistent, and it's very unlike your child, and it's extreme, meaning it seems to you that it's really out of the norm.
Mm-hmm. And I like the abbreviation, not the abbreviation, but the 4 prongs of frequency, how often it happens, intensity, how severe it is, duration, how long it's lasting, and interference, how much it's interfering in your child's function, to make it so simple. To try to keep those four principles in mind. And, I do see parents who get so anxious. They're so anxious about what's normal, right? And then the opposite of parents who just don't understand that this is not normal.
Yeah, it's interesting because I think we leave a lot of responsibility up to the parent to be able to know what's normal for the child. But I think all of us as adults have a different threshold for what's normal or what's not normal. So that's why it's always good to talk. Talk to your pediatrician, talk to a friend, talk to someone else that knows your child well. I think it's always good, be open. And over this time, I've really been advocating for the release of this expectation that everyone else is okay except
Right.
So feel comfortable to just say, what, I'm having a really hard time with my child. Can you help me out with this? Can you just hear me out and let me know if I'm thinking right about it? I think it's actually been very nice for people over this pandemic that they don't have to keep pretending that everyone, that they never struggle in their parenting, and it comes easy to them. So I think these are good questions, and we don't always know the right answers. So it's really good and commendable to be able to speak with other people about it.
Right. And also speak to the teacher, speak to the school psychologist. I think that there can be a partnership, by the way, between the family and the school and the physician. And I think that unfortunately the pandemic kind of broke that. People weren't even going to their doctor, let alone going to school. I can't imagine what it must have been like to live in such isolation with these problems.
Yes, I on one hand, I would agree with you that people felt more isolated. But as I was saying before, I think some of those barriers of I need to look just right and not, not be able to be open enough to say I'm having a hard time kind of fell, that fell away. However, there were many opportunities, and I think many schools and community leaders were trying to find ways to connect with families over this time. And I think that was actually very important because there was such a significant loss of sense of community. The school community, while you may not feel very connected to it, it does provide you with a lot. Provides your children with friends. You see other people when you're walking down the street. There's some identification as we're all part of this community. And it's true, there was certainly isolation, but there were many efforts put out to also, start something new. For example, at the school that I work at, I started a weekly webinar with parents, and it was unbelievable to me. I was so surprised at how many people showed up on these webinars, because I think before COVID, I don't think I would have gotten the same crowd to come, but people were so thirsty for a sense of community, a sense of support. We don't want to be in this alone. We want to be together with other people. And I think that would be nice if we continue that sense. We could all be, supporting each other through this, even though it's messy and difficult.
Right. And I wonder whether it's different now than when everybody was doing the same thing. I mean, what I saw from the patients that I saw during that time period is that even the children who had underlying problems were often doing better because their family was home. There was less going on. There was less pressure. And then now that we're trying to open, but we still have the disease among us, and there's so many polarization and so many different opinions and a lot of anxiety about it continuing to spread as we open. I wonder how people are going to do.
Yeah,
Children.
Yes, I think so. I think to some extent, there was a sense of we all have one method by which we're addressing this. Your parent gave you the same message, your teacher gave you the same message, your friends' parents all felt the same, and now that's really changed. I speak with parents, and they're having a very hard time, for example, finding a play date for their child that they feel comfortable with, that other child has not been exposed to other people that are not being careful. So I do think that adds a higher level of anxiety now, which is strange because we were at the peak of the pandemic,
right?
In April, but I think now because it's forcing the parents to have to make these calls, these decisions that they didn't have to make before. Just everyone was at home.
Right.
It wasn't like, well, Joey's going biking with Michael. Why can't I go too? So that is a complicated piece.
Absolutely. Are you seeing children with actual post-traumatic stress disorder?
I think I personally have not. Again, I think we need for this to be over to be able to have that retrospective look at it. There are many psychologists that are, in a way, bracing themselves for the influx of seeing children with a lot of PTSD. I personally, I'm not, while I know that the pandemic can fit and does fit the criteria of a traumatic event, right? It's an event that completely shifts your sense of normal. You feel out of control. It changes your sense of self. Yeah. So it really fits that criteria. I still think that children rely on their parents to be making decisions about this pandemic and don't necessarily feel the same level of stress that the parents do. That doesn't mean that they didn't experience this as a life-changing event or an ongoing event. But we are not finished with this, so it's not. So it's hard to be able to say we're seeing that. But I'm certainly seeing depression. I'm certainly seeing anxiety. I'm certainly seeing levels of OCD that I had not seen before. For children that are having extreme levels of worry and fear. I'm seeing separation anxiety. So, while it is with adults with PTSD, sometimes an adult gets a few diagnoses before someone hits the nail on the head and says, this is actually PTSD, all that depression, anxiety, obsessive thinking. That was actually the gestalt of it, the bigger picture of it is actually PTSD. It might be that in a few months we'll say, well, all that anxiety for that child was actually a traumatic response. But again, I think right now, I personally am able to kind of, I personally am not ready to kind of give that diagnosis for a child without it being, without us getting to the other end of this.
So we're not post yet, is what you're saying. We're just not post, so we can't be PTSD. But what would PTSD look like in a child? Because I've actually not seen too many kids with it.
Yeah, so I think PTSD in a child, there's a lot of debate about trauma in children. There has been a strong movement to move away from trauma as being a singular event
Mm-hmm.
to it being more like a complex web of events for the child that ultimately gives them difficulty. So will give them difficulty with managing their emotions. They might be more sad, angry. You might see anger, you might see aggressiveness, you might see withdrawal in a child. You might see difficulty trusting, a general sense of lack of meaning for them. You might see something where it might affect their learning or their attention. So you can see a large constellation of symptoms as a result of what we call toxic stress. So again, it may be a result of, again, domestic violence and a combination of low socioeconomic status, a combination of stressors that results in what we call like a complex PTSD in a child.
But really what you're saying is the same thing we'd see in a child who might be depressed or anxious, and children who are depressed don't necessarily cry all the time, right? They could be acting out, they could be irritable.
Yes.
They don't necessarily appear sad.
No, actually more likely you're going to see an angry child, you know, and a withdrawn child, or a child that's shut down. You know, it's like the teachers sometimes come to me and say to me, this child looks like he's completely shut down. Like I can't access this child. They're emotionally sealed off. So that to me sounds like depression. When I go meet with that child, that's what I'm trying to rule out, because or you'll see a very kind of agitated, doesn't want to get close, doesn't want to talk, doesn't want to engage, you know, more angry, and they come home, they slam their door, they don't want to talk to you. So more likely you're going to see it as anger rather than as sadness in children.
What is the role of the school psychologist here? What can you do, and when do you need to get further help?
The school psychologists, the role they played during this time was very extensive, but I could say just in terms of this topic, if you have any concerns about your child, you're welcome to call your school psychologist and discuss it with the school psychologist. If it's something that the school psychologist can either meet with your child to help you determine what's going on with the child, they could also speak with the teacher and help and consult with the teacher about how to help the child. You know, some children need a break. You know, they need to go take a walk down the hall and take a few deep breaths and go get a drink of water, or they might need someone to reach out to them during recess to help with them, right? So they might need more positive reinforcement. So they could also consult with the teacher and just give them a heads up, you know, Melinda's having a hard time managing coming back to school. She's dealing with a lot of anxiety, depression. So can you help her out? The other thing they could do is be a really good referral source. So typically in schools, counseling, unless it's on their IEP, their individualized education plan, counseling is usually short term with the school psychologist or someone else on her team. But it's very upsettingly so. It's not easy to find a therapist that you connect with, that you feel good with, that you could afford. But the school psychologist should be able to walk you through that process. You know, they might be able to help you find someone who takes your insurance at a local clinic, or they will also then be able to, if you sign a release, a consent, they could also connect with that therapist. And if the therapist has any suggestions for the school, they can then communicate that to the teacher. So they can actually play a very important supportive role.
Right. So what you're saying is on the first level, they can be there to help when children are having issues adjusting to school. The reason I'm trying to really belabor this point is because I think sometimes people think, well, my kid's getting counseling. They're getting counseling in school, and they expect that counseling to be more than it can be, right?
I can't agree with you more. I find that actually a very frustrating topic, because I think children are less verbal than adults in general, right?
Particularly if they're younger, right?
Right, especially if they're younger, and even if they're older, just some kids just haven't mastered that technique yet. Yeah, so Counseling is through play, is through talking, but then you're trying to help the child, and it can really help the child, but you need to be able to support the child in their environment. They don't have the ability to manage or control any aspects of their environment. So you need to be able to include the other caretakers, teachers, the other support team. We need to have a team for this child and say, let's all rally together and help this kid out. The counseling, again, can do something, but the really powerful piece is if we can really include the other adults in the child's life.
Right. So teamwork is key for school counseling, but for some children, that's all they're going to need, right? Depending on the issue, and others are going to need more. So you can definitely be a referral, but I can't emphasize enough, because from my end, what's so frustrating is I feel like pediatricians are kind of left out of the loop. There's a lot of concern for stigma and confidentiality in the mental health field. And, it is important, to have that confidentiality and to have the parents give permission. I can't tell you how much I want to be involved, how it's important to get your pediatrician or your child's, healthcare professional involved, because you need to create a team. And as a parent, you're your child's best advocate. So don't be afraid to say, hey, I think we need more help, and listen to people who tell you that your child needs help. Because I feel like also, because it's not visible, your child gets a strep test and you're like, oh, it's strep, I'm going to take antibiotics. And someone tells you your child may have an attention problem or an emotional problem, and it's not visible, and it's easy to deny it.
Yeah. Actually, usually my first step is to tell the parent to go to the pediatrician.
Thank you.
I think I do that like at least 5 times a day. tell different parents to go to their pediatrician, and I can find when I have a partnership with a pediatrician, I hit the gold mine, because the pediatricians can be really helpful in giving me context. I could be helpful in giving them context, and then the parent also has a sense of, I'm not only focusing on one area, I'm making sure to rule out anything physical, or if we have to coordinate on medication management, I have 2 people that each have eyes in different areas. So the school psychologist has the perspective from the school, but the pediatrician wants to make sure that physically the child is acclimating to the medication. Okay, so everyone has a little piece of it, and when we work together. So yes, the pediatrician is a very important piece, and I actually think if with a little bit of education as to what the pediatrician or the school psychologist does with the information, I think that there will be more likelihood to give consent for 2 people to speak. Sometimes there's a little bit of a lack of trust, like, oh, now, everyone in the school is going to be telling each other that my child has ADHD, right? And there's fear about that. Like, I really don't want everyone to know that. So I think, in a sense, if they're reassured that there are boundaries, and, I'm bound by confidentiality, as is the pediatrician, and we're all talking to each other, and we respect privacy and all that, a little bit of reassurance goes a long way. But I think, for any parents listening, that's an important piece, that you want to connect all your care providers. If someone, God forbid, was dealing with a physical illness, you would want to make sure that the gastroenterologist is talking to the neurologist. You know what I'm saying? Like, you want to make it's one body, it's one person.
Right. But as a pediatrician, I get reports all the time. Almost all the specialists give me my reports. I have an electronic medical record. It goes boom, boom, boom in, and I get nothing. Maybe a release to talk, but no reports. So I want to stress to the parents, please, you have to sign consent. You have to ask. You have to ask the doctor. You have to ask the therapist or the psychologist, and then give the permission. You have to make it happen, or it won't happen.
Yeah, I think also for the sake of, I think that's, I'm trying to think of situations I've been involved with that I only found out afterwards about the physical piece. And I'll tell you, I'm just giving you the opposite example. I'm dealing with a child who who becomes so anxious, he runs out of the classroom and no one could find him. And then we find him on the stairwell and, the stairwell, and we have to talk him down and do some deep breathing. And he's so overwhelmed. It's almost like for that half hour, he has almost no sense of control over his ability to manage his own anxiety. And then I found out, I think, about a few months later, that he has pretty severe asthma. So that was really contributing to his anxiety. He would start, because when you start feeling anxious, you start breathing in a more shallow way. Right? So it was very important for me to put those two together. So he would start breathing in a more shallow way, then it would trigger a large, overwhelming sense of anxiety. And then he would run out of the classroom, which to him was a way to get more air. Like he was almost like, I need more space. I need to run to the stairwell.
Wow.
But putting this all together was very helpful to him. Like when you need to go to the nurse, when you need to do some breathing exercises to get a sense of calm, you could have a break. You could come to this place instead of running away so we can't find you. When you put it all together, so I'm saying on my end also, it's very important that the pediatrician be involved.
Right. So when would you tell a family that they need to get help outside of school counseling?
That's a good question. I think school counseling could also be helpful for the child. It's like a safe place at school, even though school is generally, hopefully, a safe place for the child, but it's like you have that one person. But if I get the sense that, again, it's a little bit beyond the pale of the school counseling, that it involves a family matter that needs to be addressed in counseling. And I feel that that's very often the case, meaning when someone in your family is struggling with something difficult, it affects everyone in the family.
Right.
So everyone needs to learn to deal with it.
Right. So a limit of school counseling is it's for the child. It's not for the whole family.
Right. So
you may need to know what's happening in the family. That's not irrelevant, but that's not the same thing. Family counseling is often a very important part of outside counseling, not in school.
Yeah, so I actually very often refer out. I'm happy if I feel it's helpful to the child to also provide the counseling in the school. But I actually feel it's a very important piece because, for a parent to be struggling with a very anxious child or a very, withdrawn child or a child with social issues, it is really hard. And the child's not just exhibiting those behaviors at school.
Right.
It's almost never the case that it's only at school and only at home. So everyone needs support and tools in that situation.
And that's a perfect segue to something I don't want to forget to say or to forget to talk about, which is that one thing parents can do is take care of their own mental health and take care of how they're projecting to their children, because we're setting the tone for our kids. And so if people want to know what to do, that would be like my number one piece of advice.
Yes. It's so funny because I was reading this research the other day about this psychologist was doing this research about how parents communicate their own stress to their children. So he basically split everyone up into two groups, random assignment into two groups. And he asked he told one set of parents, to think about something very stressful and then not show it to their children, right? Meaning don't pretend that you're not stressed out, right? And then the other group, he said to them, it's okay. You don't need to hide it from your children, be able to, you're stressed out but you don't need to, you don't need to inhibit that response to your children. In both circumstances, all the children knew that their parents were stressed out. So, meaning our stress is communicated to our children. And this is not in a way to put more responsibility on the parents, but it's simply an encouragement to say, we really have to take care of ourselves, because I think actually the children's reaction to this pandemic was largely related to the parental stress. And that's why I was saying before the dose effect of this pandemic. In a lot of ways, the parents acted as a buffer to the anxiety of this whole pandemic. But sometimes that wasn't the case, and the children did become overly anxious about it. But yes, I'm certainly, I just feel like children are sponges. They pick this stuff up. And we cannot take care of our children very well if we're feeling very overwhelmed, very stressed. It's really worth it to take the time to really try to find a way to bring down your own stress level. And parents have been very creative about this, and some parents have just continued to find it very hard to do that when you have small children in particular. So again, I was telling you about that survey. So I think almost 80% of the parents responded that. So there were about 300 respondents in the survey, and almost 80% responded that they found the work-life demands were too much for them to handle
during the pandemic.
During the pandemic, and I think that is the most significant kind of predictor of the child's stress levels.
Right, but if most of us found it difficult, but a lot of us were able to still help our children handle it, what did the ones who were more successful in keeping their children more buffered do? What can we do as this goes on, because it's not over?
Yeah, meaning life comes with a huge amount of insecurity as it is, and then we had even more insecurity put on us, so we lost the sense of control. And I think in life we're not necessarily looking for control, we're looking for a sense of control. So I think what a lot of parents, many parents were doing was creating a new routine in their home. They were taking care of themselves as much as they could, even if that meant waking up a little bit before the children wake up, staying up a little later so they could take care of themselves, talking to friends, seeking out support, doing some very serious self-care. So they were maybe creating routine. They were doing self-care. They found options of ways to dealing even in a very difficult situation. And in a lot of ways, that really models resilience. That's a pretty incredible thing that most parents were really able to model to their children. This is really crazy, and in fact, we've never lived through a pandemic. And
we have no model for this. Yeah.
And
I want to emphasize self-care over structure, because every time I hear structure, I hear routines that I was not good at.
Okay.
I was really bad at that. I mean, I have older kids, but still, we just sometimes we stayed in our pajamas all day.
Yes.
And I think that taking off the pressure of people that, when they're feeling like they barely, got their heads out of bed in the morning, and that was the biggest struggle, taking care of yourself. It's like that oxygen mask model when they say on the airplane, the parents should put their oxygen mask on first. You can't help your kids if you can't help yourself, and don't let perfect be the enemy of the good.
Yes, exactly. Exercise was a major one. I saw a lot of people just walking around the neighborhood. The other day I saw my neighbors. It was 11:30 at night, and she was jogging around the neighborhood. And I thought that was great. Like, just do whatever you can to take care of yourself, because you're kind of almost like when you're. It's kind of like exactly the oxygen mask, but you're kind of conducting the orchestra here, and the orchestra will play even if you're out of sync. It's just not going to play in a way that you feel good about. And I think honestly, again, this hit hard for everyone. There was this ambiguous grief during this time, like the loss of things that we typically look forward to, like you mentioned before, the loneliness. Definitely for parents, and diagnosable increase in anxiety in parents. In parents, this was a very hard time for people to manage.
Right. So it's so important that when parents aren't able, they're back to that frequency, intensity, duration, and interference with their life. They take care of themselves. They seek their own help for mental health care, through their healthcare professional. And I want to
Yes.
thank you so much, but I want to just give people just a couple of resources for more information. Again, we're going to both reiterate that you can speak to your teacher, your school psychologist, your pediatrician, your other healthcare professional. Don't be afraid to reach out. Keep us all in the loop. But a couple of resources, there's OHEL, ohelfamily.org. There's Amudim, an amazing organization, amudim.org, and Relief, which is reliefhelp.org for specific mental health referrals. And I want to thank you so, so much for doing this with me.
Sure. Thank you.
Thank you. And Shana Tova.
Shana Tova to you and all the listeners. Thank you.
You too.